Amy Young.
Okay, go ahead and spell your first and last name for us.
Sure. Amyyoung.
Thank you. And your title.
I am the Chief Clinical Officer at UT Health Austin, Dell Medical School.
Thank you.
Should we start?
Just a minute, I'm ready when you want.
We're ready.
Sure. So I'm Amy Young. I'm the Chief Clinical Officer at UT Health Austin, Dell Medical School. And today is a very exciting day today here at UT and UT Health Austin. So we received our first shipment of the COVID-19 vaccine from Pfizer this morning. We have been working diligently over the last week to ensure that we have our plans and processes in place to vaccinate healthcare providers here at UT Health Austin. We anticipate that over the next 10 days, we will vaccinate approximately 2,900 healthcare providers that are on the state tiers for priority. In addition to that, part of the reason that this is so exciting is I think this is sort of our community and the world's first step towards combating this virus going forward. So it's a very exciting time for us here at UT Health Austin.
I just sort of, it's recapping what you just said, but I'd asked Jennifer Harrison downstairs about the moral boost. I've been in many hospitals and many stories about professionals like yourselves working your fingers to the bone, putting yourselves at great risk, taking care of people who are dying. Is this if you will, a shot in the arm?
It's a huge shot in the arm. So we started communicating once we had some certainty that we likely would be getting a vaccine. We've been watching the updates from the FDA and the ACIP for the CDC very closely, and we've been keeping our providers up to date on all of the advancements that were coming. I'll have to say that our providers were very excited to know that there was sort of hope on the horizon. We are working very hard. I myself spent 24 hours in the hospital this weekend. I would say it's been grueling, not only in the quantity of work that we do, but the extended time period for which we've worked in this way, in this fashion. And also, as providers, we like to have close relationships with our patients, and so it's been very hard limiting those relationships between the mask and the lack of visitors around patients in the hospital. So it's very exciting that, slowly but surely, we still have to mask, we still have to social distance, we still have to wash our hands, but slowly but surely, I think this is the first step towards the future and returning to some normalcy, both in the healthcare environment, but eventually for all of our country and our population.
How is it decided who gets what first?
So the CDC has put out some recommendations around who goes first, so healthcare providers and individuals in long-term care facilities. The state of Texas, who is coordinating our vaccine initiative, has given us some further guidance, and so they've created some categories, and so we have identified with our teams the healthcare providers that fit into those categories, and so those individuals will be vaccinated over the next 10 days. At least the first round of vaccine. Obviously, they'll have to come back for their booster in 17 to 21 days, as we understand it now.
How many doses did you guys intake today?
2,925.
Okay. And
Well,
so,
is that plenty to provide for the hospital and getting the first round of shots?
So that is enough to cover the faculty and residents and medical students that are all healthcare providers that provide care in this first round according to the state guidelines. One other point I'd like to make is it's really important because of the vaccine and because the vaccine has some effects that we have staggered our staff to make sure that we can always keep a critical workforce in place to provide ongoing care services as we go through this vaccine period, both the initial vaccine and the booster vaccine that will come in January.
Professionals like yourself and people in public health, prior to this day were, in an uphill battle with people wearing masks and getting people to do what they could in terms of social distancing. Now I would gather in the public sphere you have people skeptical about a vaccine. What do you need to tell people about this so they know that this has been done in the best faith forward science here, and we're here to help people.
Right. So we're very lucky here at UT. I would say that the vaccine effort's been very collaborative. I mean, we have the work of Dr. McClellan over on the main campus that helped develop the vaccine, which has been really huge. We've had a lot of help, for example, from the modeling consortium with Lauren Myers this whole time, helping us understand what was going on in our community and being able to sort of plan ahead for what to expect. And so I think delivery and administration of the vaccine is just one more step. But again, I think the most important thing that we have to remember is until we get to some level of herd immunity, it is going to be critical for folks that are vaccinated and folks that are not vaccinated to remember, wear your mask. We know that science supports mask wearing in the prevention of this disease. Really important to keep our hospitals open and to keep our intensive care units from being overcrowded. Wear your mask, social distance. Do the things that you need to do to go about your work and your life and maintain sort of a balance there, but it's really important. Wash your hands, wear your mask, and stay 6 feet apart.
It's a bit of inside baseball, but all these vaccines have to be stored in really, really cold temperatures. Why is that?
Yeah, so this vaccine has to do, it's an mRNA vaccine, and so the way that this vaccine works is that the mRNA gets delivered and the cell basically makes the protein that makes that your body then makes the antibodies to in order to protect you. And so because of that technology, it requires ultra cold storage, which is part of the reason why we were able to start this process at UT. We had access to the necessary freezer capacity and the infrastructure that we needed to be able to deliver the vaccine effectively.
Earlier you mentioned herd immunity. What would it look like, or what would it take for us to reach that?
That's a good question that I can't answer for you today. I think that there are a lot of experts that opine on different numbers in that particular space, and I don't think we understand exactly what that final number is. There's some thought that because the vaccine is so efficacious that it might require a little bit lower numbers, but we don't know the answer to that yet.
What would a lower number look like?
We don't know exactly what that number is yet.
Going back to generally speaking, what's the big picture message that you want all the folks at home who are going to see this today to take away?
To have hope. Vaccine is coming, but it still does not remove our responsibility individually and societally to continue the practices that we know that are helpful, that we've talked about: masking, social distancing, and staying 6 feet apart. We all need to work together in this. Where we are as a country right now, to keep our numbers in check and to keep our hospitals from being overcrowded so we can continue to provide safe care, not only for patients that have COVID, but patients that present with heart disease, needing surgery, traumas, all of the other things that require hospital beds and care. It's really important that we try to keep COVID to a minimum as we start to increase the immunity of our population.
So, again, somebody like myself, John Q. Public, average, male, good health, I should be prepared to wait several months at least before I can expect to get a vaccine.
You would be one of the people that be a little bit later in the tiered process, right? So it's really about getting people that are necessary to continue to provide healthcare services, or folks that are at higher risk of exposure, which is why healthcare workers are sort of moved up the list. But then we will start to slowly work our way through folks that are at higher risk, our older population, our patients that have different diseases that make them more likely to be sicker with the disease, and ultimately we will work our way through the population.
Thank you, ma'am.
Do you have a question?
I'm just wondering personally, are you affected by COVID, whether it's a family member, yourself, if you've had COVID?
So I have not had COVID, thank goodness. I have worn my mask. I have stayed 6 feet apart. And I've been responsible for helping maintain the health and wellness in this particular building specifically. And we've done a very good job. Our employees, our students, our residents, they've done a great job of protecting each other as we go through this process. And I would say the same thing is true for UT. UT has had an initiative since UT reopened in the fall called Protect Texas Together. And I think our students and our faculty and staff have done amazing a job of protecting each other and protecting the community. I've had a few family members with COVID, not here in the Austin area, and it's just so happens that when you're the doctor in the family, they all call you for advice, and so I've had a lot of, I would say, input and responsibility with care coordination from others in my extended family.
Thank you so much for sharing that.
Anything else, guys? Amy, any parting words?
No, just tell everybody to wear their mask and stay 6 feet apart.
Appreciate it.
Thank you.
Thank you.
Dr. I just need to get the microphone from you.
You didn't want me to take it upstairs?
Might be a riveting document.
Are you delivering data?
Thank you so much. We'll be in touch.
Okay, perfect.
Appreciate it. Bye now.